Hi everyone, it's Jody Schwan at Sioux Falls Business. Thanks for joining us with this special live Q&A featuring Bill Gassen, Sanford Health's Chief Administrative Officer. Apologies to those of you who were looking for us a little bit earlier. All I could say is it's technology. I think at this point I figured it out, but we'll see together here as it all goes along. Here comes the first big test. I'm going to bring in Bill Gassen out at Sanford Health's corporate headquarters. Hi, good afternoon, Bill. Can you hear me all right?
I can hear you well, Jody. Good afternoon. Thank you.
Okay, let's check off that first box then. Terrific. So, hang on. Here we go. All right. Bill, I wanted to bring you on and have a conversation today about a few things. First of all, for those of you who don't know Bill, he wears a lot of hats out at Sanford Health. His new title actually is Chief Administrative Officer, which means I get to talk to him about the people of Sanford Health, the facilities of Sanford Health. Ironically, even if we wanted to talk IT, we could here as we've attempted to make this all work. Bill, did I delineate your responsibilities thoroughly? Are there other things that you oversee that we should maybe let people know of here right off the top?
Yeah, thanks, Jody. No, I have a great opportunity to work with a really talented group of people out here at Sanford. So I get the privilege of working with human resources leadership, the IT leadership, facilities and construction management, business development, legal compliance, risk management, and Sanford Sports as well.
So basically, you've got a lot on your plate on a typical day. How has life, how has work changed here, even in the last weeks, month, however long COVID-19 has been a dominant part of the conversation for you and the rest of the leadership team?
Yeah, as we're all aware, I mean, COVID-19, the pandemic, has really had a significant impact on the world around us. It's beginning now in these last few weeks and last month to really start to have an impact on us here in the Dakotas and especially at Sanford Health. While we're fortunate that we don't have the level of patients that have tested positive as some of the other parts around the country and around the world, we're busy preparing to make sure that we're ready to protect our frontline caregivers, our patients, our communities at large, to ensure that we're doing everything that we can. So the teams are very busy right now.
So there's a big team over at Sanford. I think about 50,000 employees, probably more by this point. You had a big announcement that affects really all of them to a certain degree, but more specifically, your hourly folks came out late on Friday that you're going to be implementing some nice additional measures for them. Why don't you detail out what those are and what led you as a leadership group to decide to implement those at this point?
Certainly. Thank you, Jody. As you mentioned, we've got 50,000 strong within our Sanford family. And so across the United States and 24 different states and 9 countries around the world, we're busy doing all that we can to help improve the human condition. And right now, because of the things that we've talked about with COVID-19 and the substantial impact that it's having in the world around us, we made a decision as a leadership team in consultation with our board and really at the leadership and provocation of Kelby Krabanoff, our president and CEO, that we really wanted to step out and be proactive, take a stance to make a positive impact for our employees who are really on the front lines, those individuals who are most likely to be impacted by the changes going on around us with COVID-19. And so we did is we stepped up and decided that for our hourly employees, for our non-exempt employees across the system, we wanted to do a couple things. First off, during a time like this when hours are flexing and as we know from non-essential procedures, volumes are down, we have individuals who are starting to be concerned about what does that mean for me? What does that mean for my hours? What does that mean for my family? And so we really wanted to step up and make sure that for the next 3 months, they would not have to be concerned about their health care insurance, that for their group health insurance, that Sanford would pick up 100% cost for all those premiums. So regardless of whether somebody's part-time, whether they're full-time, for the next 3 months, they do not have to be concerned about paying their premiums for the health insurance if they're part of the Sanford Group Health Plan. That was the first step that we wanted to do. We wanted to provide them and their families with that peace and that comfort, knowing that they'd be cared for. Secondly, we really wanted to make sure that we also stepped up and made sure that we were able to put a little extra money in their pockets. So we came forward with a decision as part of our Sanford family stability plan is that we wanted to provide each one of those hourly employees whether they're PRN, whether they're part-time, or whether they're full-time, with an additional spiff. And so for full-time employees, we're giving them an additional $300 on their paycheck on April 17th, $150 for our part-time, and $50 for all of our PRN staff on their April 17th paycheck. We really wanted to do that for them, to provide them with some additional money for them and their families during a time when there's a lot of uncertainty out there. The additional measure that we took, as well as kind of the third part of that plan, was that we wanted to make sure that individuals, with respect to their PTO, if they were going home because of low volumes, if there were changes to their schedule as a result of that, that they would not have to fill using all their PTO. So if they want to save that PTO and preserve it for another time for their family, we wanted to give them the flexibility to do that. So they could use that PTO if they wanted to or not. And then depending on what happens with their schedule, if they dip below full-time or dip below part-time hours, we're still wanted to hold them harmless and make sure that they still qualify for those full-time and those part-time benefits, irrespective of that. And so that was the first part of the Sanford Family Stability Plan that we're calling it. The next portion of that, too, is the outpouring that we've had from a number of our executives and our physician leaders across the organization saying, how do we help? What things can we be doing to be a part of that solution? And so we're running a campaign this afternoon. Mike Aberson and I will actually be shooting a video promoting the opportunity for all of our employees to give to the Sanford Crisis Fund. And that's a fund that will be providing additional monies to any of our employees who are in need. Their families have been affected by this. We want to provide them with access to it. So in addition to the monies that we always have in there, we're now providing an opportunity for our leaders to donate their own dollars to that if they want to as well. And similarly, probably the last part is the PTO donation. We have a number of individuals who, in addition to giving cash contributions, also have a desire to donate their PTO. And so we're allowing individuals across the organization to donate their PTO to any of their colleagues or donate it generally to the fund to be utilized by anybody who might be in need.
Fantastic. Those of you who are watching, if you do have questions for Bill Gassen, go ahead and write in with those. Obviously, lots of new benefits designed really for the entire workforce, more specifically for those hourly people. Bill, where are you at, in your modeling as it relates to staffing? Are you at the point where you're trying to cross-train employees if they are needed in some of those high-volume areas? Is there a point where you would look at doing something like that?
Yeah, great question, Jody. We're really fortunate here at Sanford Health that just based upon the way that the COVID-19 pandemic has developed, we have line of sight, we have a head start. So we've had a lot of opportunity to really become prepared. From a staffing perspective, right now, we actually have a little bit more space than we would have otherwise, as we know through a lot of the protective measures that we're voluntarily participating with around the state, both in North Dakota and South Dakota and Iowa. We've had a lot of those non-essential procedures not being scheduled right now or being rescheduled for later. So that's allowing us to have time for staff to cross-train and do a number of things. But we know that and we're anticipating sort of that spike to come and those volumes to return. So what we've really tried to do during this downtime is cross-train a lot of those employees, just as you've stated. We have a number of employees who, outside of their current functions, either in a past life, past jobs, have prior certifications and experiences, or just have the ability to cross-train over. So we're right now cross-training and upskilling a number of our employees so that they can be prepared to help out. And no surprise to us, but the number of individuals we've had step up to say, give me an opportunity, I'd love to take a position on the front lines. When and if this hits and we have an influx of patients who need our care here at Sanford Health, want to be a part of those care teams.
This is a narrative that is really ramping up nationwide, so I'll ask it here locally for you. As those people do volunteer, as they prepare to work on the front lines, as we call it, how do you feel about your ability to equip them? How are you sitting as far as the personal protective equipment and the general medical equipment that's going to be needed for the patients as well as for those healthcare workers?
Yeah, we're very blessed here at Sanford that right now we feel like we have sufficient PPE or personal protective equipment for all of our caregivers. As we all know, that's and you've seen in the media, that's a constant effort. Each and every day, our talented operators and folks in the supply chain team are constantly working on being able to procure enough to ensure that when and if that spike hits, that we'll be prepared, and most importantly, to make sure that we give the assurance for all of our caregivers who are on the front line, as well as that assurance to our patients that they're going to be cared for and they're going to be safe. Right now, we have sufficient, but we're certainly constantly looking at ways in which we can procure more of that valuable equipment to just make sure that we're ready when those spikes come.
Good to hear. 50,000 employees sounds like a lot, but is it enough? There are health systems, again, also around the country that have put out a call for retired workers or maybe those who have left the field and might consider returning. Is there a scenario under which you wouldn't do that, or do you think you'll be sitting okay?
We're actively doing that right now, actually, Jody. We do feel very comfortable right now. We do not have any staffing shortages, and we would hope that that wouldn't be the case. Again, in an effort to be proactive, we started over a month ago with reaching out to a lot of those recently retired employees to see if any of them would have an interest in coming back. And so we've looked at sort of those who've been out 180 days and those who've been out a year and have retired recently to see if they want to come back, refresh those skills and training and certifications, and then be ready to serve. And we've had a great outpouring of individuals who have been willing to and anxious to do that. And so we're continuing to do that. And again, we think of that as more of a safeguard or a safety net. Right now, we're comfortable with the staffing mix that we have. We're comfortable that we've got enough, but we always have to be prepared. And there's no certainty with exactly what will come.
Well, and I would guess not only trying to prepare for that patient volume, but, the very real possibility that some of your workforce is going to get sick, too, throughout the duration of all of this.
That's correct, Jody. I mean, despite best efforts and all the equipment and all the precautions that we have and that we will certainly exercise, we know that that's a risk. I mean, you look around the world and you can see statistics from 10 to 15% of healthcare workers who end up becoming infected with that. And so we know that that's a reality. And even if not while they're delivering care, if it's through a loved one, through family members, they may otherwise be exposed as well, too. And so we know that that's a reality both inside and outside the workplace, that they could become exposed. We really do want to be prepared and make sure, again, that we're ready to meet that need and that demand that our communities need.
Yeah, exactly. And I don't know how well versed you are with the Good Samaritan organization. I have not had a chance to get an update on that lately, but curious how those operations are sitting, particularly because you're in so many states. When we look at those curves, you're going to have places that are in different stages of this all around the country. How are they getting by so far?
Very fortunate right now. Randy Berry, who's the president and CEO over at the Good Samaritan Society, and his team have done a wonderful job of preparing. He'd be the first one to tell you the hard work is on the front lines with those site administrators who are in those facilities across the 24 different states. We know that those are one of our most vulnerable populations across the world when it comes to potential infection and just the way in which that impacts those individuals. We're very fortunate that right now, at this time, when we know it could change any moment, we don't have any residents who are positive in any of those facilities right now. We've got over 250 facilities across the country. But we do know that it's not sort of a matter of if, but when. At some point in time, we know that that's coming. So we're continuing to take every step we can to be prepared, to prepare our staff, to educate them, and of course work with all the local and state authorities to make sure that we're availing ourselves of any assistance that might be otherwise available there too.
Well, very good news so far. Like I said, it had been at least a couple weeks since I had had any updates from them. So each day that goes by, I'm sure, is a sigh of relief there. If you are just joining us, I'm speaking with Bill Gassen, Chief Administrative Officer at Sanford Health. We've talked people. We've talked some of the things they're doing to try to support their people. I'm going to shift gears here briefly and talk facilities because there's been a lot of changes there, too. The sports complex, for instance, some of the other Sanford facilities that are just not being used as normal. What are some of the headlines and the highlights as far as the largest facility impacts as you've been dealing with those, Bill?
Yeah, and it's really across the board. A lot of those sort of non-core, non-traditional healthcare areas of ours have certainly been impacted, whether it be on the retail side because of the closure of non-essential businesses, or whether it's just because we've had to shift talent over. Some of our more public-facing venues like the Pentagon. Obviously, we had national tournaments that were interrupted as a result of this, ongoing games with the Skyforce, things of that nature. And so what we've tried to do is really flex that staff, find new places for them to work, new opportunities for them. And a number of them clinical backgrounds, and they've decided to upskill or uptrain over to start providing some of that assistance for us. And whether it's getting on a call and helping to triage phone calls, whether it's helping out over in the call center with our IT department, those areas. And then probably most hardly hit this last week with the decision to close down the restaurants and bars and entertainment venues in the city of Sioux Falls, which we support. I think those are the right decisions in the interest of public health. But with that, we had to close the doors on Great Shots and close the door. Well, so we had a number of employees who were impacted there. And the conversations that we had with them, we emphasized that when this is over, on the other side of it, we have every intention of reopening those doors. We'll gladly accept them and want them back. It's a talented team, but we know that we needed to allow them to go out and avail themselves of. So, with them right now, but we're going to bring them back into our doors as soon as we can.
I apologize. You cut out a little bit there. Hopefully the rest of you could hear Bill. I struggled a little bit, but as he said, having to comply with those city regulations, obviously important on several levels to wind down the operations temporarily within the sports complex. Some of those restaurant and entertainment venues, community supports those a lot. So I know as soon as they're able to, they're going to be beating down the door to get back in. So it'll be nice to watch that rebound. Unfortunate, of course, to lose them and so many of those other entertainment type of businesses here in the short term. What else am I missing, Bill? One question I think I did wanted to just talk briefly about, and as far as facilities and contingency planning go, and again, Sanford's doing a great job modeling this, and I know that's a moving target depending on a whole lot of different assumptions and real data points on the ground, but there have been other organizations nationwide, other states that are looking at really shifting the way they provide hospital care when that surge, as they say, arrives. Potentially designating some facilities as just for COVID-19 patients and then other alternate facilities for non-COVID-19 patients. Is that part of the planning yet? Is that part of the thinking yet at Sanford where those facilities are concerned?
Yes, thank you, Jody. That's part of the real-time dialogue that is underway right now. We're continuing to speak with our local leaders, our state leaders, speaking with the governor's offices in both North Dakota and South Dakota, doing everything we can to share our data, to hear from them about their data. And there's a lot of assumptions that are built into these modeling that we have right now, but we feel like we're getting closer and closer to a point where we're able to agree on what we think those underlying assumptions are, which then really helps us plan and helps us take action steps, working closely with our local mayor's offices as well. And part of the planning is, making sure that we've got inpatient facilities to care for those individuals, but then also looking at sort of a step down. Where might these patients go when they're no longer needing that most intensive care and they're able to leave the ICU, but we believe they're still in a position where they can still shed the virus. We want to make sure that we're continuing to care for them and protect them. And again, in the interest of public health, we want to make sure that they're no longer shedding that virus before we sort of release them back out there into the rest of the population. So doing lots of different modeling and facility plans. And I just really want to thank very much the governor's offices, our local mayor here in Sioux Falls, Paul Tenhaken. They've all been very gracious in meeting with us and allowing us to really kind of work together sort of real time, beat up assumptions, challenge those thoughts so that we can get to a place where we agree and see the world the same way. We're all driving towards the end, the same end. We're trying to protect our patients. We're trying to protect the people of the states of South Dakota here, North Dakota, Iowa, Minnesota, and then everywhere that we're located with our long-term care facilities.
Terrific. Anything else, Bill, that you've been getting as far as questions from employees or other stakeholders that you just want to address before I let you go?
One, I just would be remiss if I didn't mention the fact that our talented frontline caregivers just never cease to amaze me. We have questions that come up. Obviously, they're concerned about what it means for them, what it means for their family, but without exception, they say that they're here to provide care. This is what they do. They stand ready to do that. They trust us. that we're going to provide them with the protections that they need, which is why we came forward with a Sanford Family Stability Plan this last week. But I'm just amazed at the talent and the resolve that they have. So many of them are sort of standing at the door waiting. When is it going to come? We're ready, we're prepared, and now we want to step up and be able to start treating these patients and caring for them. And especially on today, I'd be remiss if I didn't give a special thanks to our physicians out there. On National Doctors Day on March 30th, we recognize our talented physicians and just really want to give them a great thank you for all that they do, the amazing leadership that they provide for us. And we could not do the things that we do at Sanford Health, obviously, without our physicians. And so we just want to give them a special thank you. And thank you to all the other talented physicians across the state.
Oh, absolutely. What a timely day. All right. I'll let you get back to work. Thank you so much for your time. Thanks for joining us. Thanks for the work that you and your team are doing. Stay healthy, and hopefully we can catch up again soon.
Sounds great. Thank you, Jody.
Thank you.